on the pop-up. If you want to introduce yourself in the chat, that would be lovely so we can see who's here today, but no pressure if you don't want to. And then I'm going to hand over to Katie to kick us off with the introductions.
Yeah, a huge thank you to Rachel for organising this. We're really pleased there's been so many people that have signed up. This is such an important session, and we hope you all enjoy and learn, able to share anything in the chat function as well, because there'll be Giselle, Anne and myself doing the chat. Ask any questions and we'll be feeding those back to Iggy, some of them as we go along and some of them at the end, and those we don't have time for we'll save and we'll feed those back to Iggy after the session and get back to you all as well. So yeah, really pleased you're here, Katie, from bringing us together. I know a lot of people here from previous work, and Tasha's nodding her head, and yeah, the journey that I've been on. So it's so good to see so many people on this session. And bringing us together works very closely with Anne, Iggy and Giselle to run lots of courses like this one. We've just got funding to run some more sessions thanks to Skills for Care, so watch this space, and it's great to be with everyone. So I'll pass to Anne, tell you a bit about herself.
Hi, my name's Anne. I live in a small town called Market Harborough in Leicestershire. I've had a social care package for forever. It feels like forever, probably about 28 years in some form. A third of my funding gets paid by CHC and the rest by the local authority. And I run a charity called Being the Boss, which is there to support other disabled people who are employing their own PAs. Thank you.
And Giselle.
Help I put my microphone on. I'm obviously not very tech minded, but I'm one of the admins of Adult Social Care Warriors. I'm also a parent carer, and set up the group because, as we can see today, so much information and support is needed that isn't just being given and isn't out there. So one of my special interests is DRE and charging and things. So I'm really looking forward to today's session, and thank you everyone for coming. Over to Iggy.
Okay, thank you, Giselle. It's lovely to see you all. Some faces I've seen, some faces are new, so welcome everyone. My background is, my employment started as a trading standards investigator, and I did that for about 20 years, and taking many criminal prosecutions for the local authority. I think I took 70 in total. My ambition at that time, which I achieved for a couple of years, was to get enough fines for them so that it equaled my salary. So I didn't cost anything to the public. That's from that. They've always had a muscle wasting disease, but I didn't know much about it until much later in life. As time's gone on, it's got worse and worse and worse. I started off on social care and moved on into, I'm now fully funded by health. There is a lot of overlap, a lot of wastage, a lot of background stuff that they don't tell you what they should do. It is one of their duties. The benefit I have is that my past experience has enabled me to learn how to read and interpret the law. I actually enjoy it. Most of you might be reading whatever fiction novels. I'm in bed reading the Equality Act or the Care Act, and understanding how the law is made is important and how it works. I think that's the future session where, actually, when we did a poll, a lot of people did say that they wanted to try and understand So we'll, as a group, be bringing something together on that in the near future to keep open. As we've said, it's got a lot to go through because I'm trying to cover everything from the beginning till the end in a very short period. You will have questions. Please put them. We've got some excellent people and years of experience, Giselle years of experience, to answer your questions and actually send you links and information in the chat. So please put that in there. Don't worry though, Giselle's also created a phablet. And what that does is has lots and lots of links. Just going to try and put my volume up. People saying they can't hear me. Okay. Links together in something called a phablet. And that phablet is full of information with regarding where you can go and where you can find out further information from. Just bear with me a second. Okay, try again. Right. The whole session is dealing with car charges and disability related expenditure. We will be moving slightly off the topic whenever it's appropriate to do so. Okay, so next slide, please. Okay, we're looking at, like I said, starting from right at the beginning. And what a lot of people don't understand is how the assessment process works and the principles of well-being, how an assessment should be done compared to how most local authorities do it. And there is a good reasoning behind that. We'll be talking about prepping for your assessments or reviews, arguing about budget sufficiency, and how to argue a case. We'll go through financial assessments, disability-related expenditure, what to do if you don't get your disability-related expenditure, or you owe money and you want to argue that. We'll go through the complaints process, and then we may talk, if we have time, other ways that you can potentially save money to try and maximize money that you've come in. Next slide, please. What the CARE Act starts from is basically from things about issues from when you leave hospital. Because when it was originally envisaged, it was people left hospital and weren't fully recovering. It's not like the old days when I remember you'd go in for a broken arm or something and you'd spend 2 weeks in hospital recovering. Nowadays, they want you out. So the only way they can deal with that is by providing care. And it's been around for a long time. I think the National Assistance Act, which is the original of the CARE Act, is dated 1948. So just after the war, they realized as we needed NHS, we needed the care as well. What the CARE Act says right from the beginning is if you do have needs on leaving hospital, and you should have a care assessment at that time, but I know lots of authorities struggle with that and will try to do assessments later, but you are entitled to one at that time. The first 6 weeks of your needs are completely free. They can't charge you for those, for any of that time. It's called re-enablement. And this is in order to try and get people back on their feet as best as possible. All equipment less than £1,000 is also free. So if you need any immediate equipment, like handrails, small pieces of disability-related equipment, your social worker or the hospital should be able to provide those. If you don't go through that route and you go through saying, okay, I'm at home, I'm elderly, I've got a few disabilities, they've got worse, and I need some help, and you phone the social work department, the time starts for them at the time of contact, right at the beginning. So that's the time where your original assessment is dated to. There's some important things I'll keep going back to. It's really important to try and keep notes where possible, just for your own benefit. We're all human. We have conversations. People forget what was said and what wasn't said. If you, after you've had a conversation, write what you said and what they said, at that time it's good notes. You can then refer to and say, at that time, these notes were made. The questions you want to ask are in that little box, known as a Socratic method, based on Socrates, going out and asking questions, and people ask him stuff. And those are how, why, what, when, where, and who. And I think there's a saying as well. I have 6 wise friends who taught me all they know, and those are the questions that they ask. So these are the basics. I mean, it's almost like an investigative tool to prepare you to how to manage and navigate the system. I'm really sorry to say it shouldn't be this difficult. It doesn't need to be this difficult. But whether it's government or the NHS or whatever reason there is, it has become more and more. I've got my own views on that. I'll keep them private. So next screen, please. If you do have questions, we don't get to them, I will, and they're sent to me, I will individually respond back. I'm happy to do that. So it doesn't mean whenever we do these sessions, they don't finish with just the end of this hour. You can come back to us and ask us further questions. The other thing, which I would be great, is Giselle's site, who I'm an admin for, also is a good place to share information and knowledge. And I'm not the complete expert. There's plenty of experts out there in their own fields. And, you know, it's a brilliant place. There's like 4,500 members, and it grows daily. But it's an absolutely fantastic resource. Giselle shares a lot of my work on there, so you will get updates on new things that I'm thinking, or new ways to find solutions, etc. Okay. The first thing is, when you have care needs, they will ask you, and this is a step-by-step process, is it physical or mental? If you've passed one of those, then that's a tick. You've passed the first box. Then you look at the square box in the middle, okay? And you've got lots of different things on there. Let's start from the top, 12 o'clock, maintaining hygiene, maintaining nutrition, toilet needs, clothes, home safety, maintaining a habitable home, develop and maintain relationships. This is a good one because they always try and not pay on this. It's access, engage work, or education training, even if it's voluntary work. And for carers, a separate, you can ask for a carer's assessment to have your needs assessed, is how you're managing your parent responsibilities. I don't know how many people do have carers assessments. And if you have needs for things like respite, you need to make sure you look after yourself and you ask those. You know, they should be doing. If it's a family member, you should be asking the carer in the family. One thing to point out though, under the Care Act, it's very clear that caring is a choice. You don't have to do it. The duty is on the local authority to meet need. Okay? They will try and push you to doing as much as possible. Remember, it is a choice. If you don't wish to do it, because you don't have the health, you've got various other commitments, then it is their job to make sure those needs are met, not yours. But a lot of people aren't told that. They automatically presume that it's people's responsibility. And yes, there is some of that in life. But as our democratic system that we have in this country is, you shouldn't be forced to do anything you don't want to. After the physical or mental, if you can meet, if you have difficulties in 2 or more areas, you are deemed to have a certain assessed needs. So, if you can't manage personal hygiene, and you can't go to the toilet properly, for whatever reason, we'll talk about in more detail, then you have assessed needs. So it's any 2 from that middle box. As long as you have those, when they are going to do your assessment, they are going to use these things to actually ensure what needs need meeting. Okay? So when we talk about needs, it's not just anything and everything. They have to be specific in relation to this. So when they're asking questions like, you say, well, I haven't got time to go out. You know, you're not giving me any money for that. And they say, well, we don't have to do that. Well, yes, you do, because it's my need to access local facilities. Or, good one that comes up quite a lot, cleaning and gardening is like, well, I need help with that, need money for that. And they'll go, oh, no, that's not a need. But it is as part of maintaining a habitable home. So you see how you can argue those individual needs and fit them to your situation. They're very wide, okay? So like appropriately clothed can mean wearing the right clothes as well, for the right temperature, making sure you can take those clothes off for the right temperature. If you can't get dressed undressed, then, you know, it might be appropriately clothed. Managing toilet needs. Don't forget, it's not just actually at the time of the toilet. It's getting to the toilet within time, safely. Can you get up, clean yourself, get redressed, wash your hands, and be comfortable? That whole thing comes in managing toilet needs. If you can't do one of those things, then that need must be met. Okay? Once you've passed the 2-stage criteria, all the needs then in that middle box have to be met, regardless of whether you need them at the moment or not. Okay? The Care Act says, and this is a huge part that they never tell you about. People talk about well-being all of the time. They say that, oh, we're looking after your well-being, or it's about well-being. What they don't tell you is well-being is very specific, and it's mentioned Section 1 of the Care Act. So everything you do your life is based on well-being. So when they assess your needs, It's not enough to just say, right, maintain personal hygiene, say as an example. But they need to also put in with that how that will improve your well-being. So in that case, it would be dignity or personal dignity. It would improve that because you'd feel better about yourself. So going out, access, engagement, work, training, gives the well-being of participation in work, education, and training. Or socio-economic, which basically means you have enough money to live on. Whenever a court case is taken, the courts always look at whether your well-being, regardless of your needs, your well-beings are being met. So that's the ones on the outside. And you should be asking, if they say, well, you can't meet this need, then say, well, you're not meeting my well-being principles, which is the core main reason of the Act, including things like day-to-day control, and all those other things like suitability of living accommodation, and having conversations and being part of society. That is really important. There's back in my equality and diversity days, there was a study done by an American psychologist pre the race riots, and he actually went to South Africa, because I'm talking about America, South Africa, where he studied the apartheid system. And his idea is, if you want to get rid of discrimination, and I believe this, if you want of discrimination, stop discrimination, you need to mix more. Simple as that. The more you mix, the more people become aware of your needs. So getting out there, I was talking to Katie, just praising how her daughter manages to get out there and integrate into life and not putting up with, oh, it's not accessible, it's not fair. Because the more we do that, the more it becomes a problem for society. Okay, so next slide, please. Okay, it's really, really important. If you haven't had social care yet, for an assessment, is to prep for that assessment. Please don't leave it until the day when they come through that door. Use that diagram, and we've done a self-assessment form that you can use later on, that you'll be able to see. But the idea that I started with was 2 weeks, 3 weeks before, whenever it's time, go to 5 minutes, sit down, go through that list of assessment needs, and write down what you had difficulty. When you had difficulty, what did you do about it? What would make it better? Okay, so wants and needs. Remember, these are needs at the moment. But what about what you want to do? I might want to go volunteering. I might want to do a couple of hours working in a shop, but I can't do that because I don't have the assistance. So those are future wants. It's not just about what you need right now. You need to consider all the other things that you'd like, which fit into those categories. Once you've done that, they'll come and do the assessment based on those needs, and they'll ask you for the information. What I would suggest is I did was when they came, I just handed them my diary and said, take that away, and I want that added as part of my assessment. It is your assessment. It's your needs being assessed. It's your views that have to be taken into consideration. If you give them a copy, they cannot say later, oh, we missed that, or we forgot that. Just, if they say, oh, we don't need it, doesn't matter. I'm giving it to you as a copy of my own personal assessment and my needs, just in case something later sort of say, they might say, oh, well, we don't do that. If you've written it down, given it to them to say, I have difficulties in this area, they can't turn around and go, well, we don't know about it. So it's really important to do that. Care, social care, is financed and chargeable depending on leaving you with a certain amount of money so that you can manage. That level is way too low. We all know that it's not enough to live on. It's known as the minimum income guarantee. After doing your assessment, you're left with a minimum amount of money to be able to live. But we're going to talk about how to drop some of those care charges, because there are ways you can do that. I honestly believe that no one should be paying for care.
Okay.
Definitely from a point of view of, if the assessment is done properly, if your needs are met properly, if your disability-related expenditures are considered and taken on board, most people will be paying peanuts. The problem is, nobody actually tells you about disability-related expenditure. Nobody tells you what is, what isn't, how you can argue it, how you can fight it. A lot of processes are being put in place at the moment. Some of them they've just put into place. Don't believe everything they tell you. Like, if they say we're doing a disability related expenditure and we only pay banding, high, low, medium, where does it say that in law? That's something you've made up. That doesn't apply. If my costs are at this much, I am entitled to that much. The starts costing you when you've got savings between 14,000 and 23,000, roughly. And once you get to about 23,000, they expect you to ensure that you can pay for yourself. That wouldn't even last a couple of months for me if I had that much, just because of my care needs. You can self-assess, and you can be a self-funder. If you're a self-funder and you reach out to social care, they can't charge you more than it costs them to provide that care. Okay? Be careful, because they employ companies to come and meet your needs. And those companies make a profit. So it's, and for me, it really gets to me that most of the money from the NHS social work is thrown away and given to companies to run agencies. If they gave us the money so that we could employ our own staff, it would be a lot cheaper for them, because we don't make profit. But for some reason, I don't understand it. They just won't do it. I'm going through a personal situation on this right now, where I can't meet my own needs for care because I've got 24/7, because I just can't recruit. And I've tried and tried, and you'll see I've done blogs on how to do it, how to meet, do everything possible that you can to recruit. But even then, because of the pay, at the end of the day, being so low, it's not an attractive job. Supermarkets are paying £14. It's as simple as that. So I asked for them to increase my carers pay to £14 so that I could make it, recruitment could be easier. And this has been happening for 2 years. Because I've been trying to recruit for 2 years for gaps. And this is the CHC, they've said, no, we won't increase your funding, but your needs can be met by a care agency, which will cost them £80,000 a year more. How does that make sense? Anybody's got any answers to that one? I'm willing to learn. Can we move on to the next question? Slide, please. Okay. This is your basic, I know you can't see this, but you will get copies of this. And there are copies in the phablet that will link you directly to this form. This is a very basic form I've created to enable people to self-assess. The regulations and the statutory guidance, statutory makes it legal. The legal guidance under the Care Act says you can do as much of your own assessment as you want. So who knows better than you what your needs are? Hence, I would recommend to most people, use this as a guide. You don't have to use it exactly, but it's a guide. On one side, you've got the pictures, which give you an idea of what the need is and how it should be met. Next to that, whenever you're having that need, the question is, when? So when did that need occur? Time, a date, place. It's important those things to notice. Then how did it happen? Okay, where did it happen? Why is just as important, because I can't get to the toilet because my legs don't work, or I can't eat because my arms don't work. Those whys are just as important because it adds in. And at the end of the last box is well-being. And you've got a list of your well-being needs, and you can add those. So if you do this for me, give me money to do this, this will improve my life with this well-being. Can be more than one well-being, but it's important to show that it's not just need. It's important to show that it affects your life, how it will improve your life. And I'm sorry, but I don't see any social workers doing that as a requirement. But it is in the Care Act, and they should be doing it. And every court case that I've read, seen, dealt with, taken, has always the judges gone back to, well, what well-being need did you miss? Not what need you missed, or well-being. That's the important bit. Okay, next slide, please.
I just want to say before we go to the next slide, I do not use any jargon.
I'm sorry, I couldn't hear you, but I will.
Like, I do not use any jargon.
No jargon, Iggy.
Okay, I do apologize. Unfortunately, the jargon is built in into the legislation. I'm trying as best as possible to try and make it as plain English. I mean, like with the slides, try to do diagrams wherever I can and try and break it down to simple. But if I do, please ask. Please just ask one of my colleagues in the chat, and I'm sure they'll explain.
How about afterwards, if there's words we don't understand, then you can maybe write down a booklet of the jargony words of an explanation.
We're happy to do that. But again, I mean, just to keep things flowing.
And I just meant for later dates.
Yeah, I try not to use jargon, but if there is something you don't understand, there's always adult social care group, and a lot of people with learning disabilities do come on there and people are very good. Giselle's amazing at trying to simplify and make things easy for us. I do apologize if I have used any jargon at the moment, but if you hear me say something, just put it in the chat and one of the people will reply to you as to what I mean. Or if it's not covered, I will do it at the end afterwards. So it's an example of how to fill in a self-needs assessment. A needs assessment is what they call how they're going to manage what difficulties you have and what you need. So I just have to say, managing nutrition, so that's eating tablets or having the right food, appropriate food at the right times, etc. So that happened on 10 o'clock a.m. on the 9th of April. Where did it happen? On the kitchen service table while I was getting there. So what is the reason why? Well, because of my disability, muscular dystrophy, I find it difficult. And like what actually happened? So I have difficulty lifting the kettle, opening the cereal, and getting food to my mouth. Oh, I was by myself. So what does that affect my well-being? Lack of physical health and the day-to-day control. So that's like just one little bit. And you go through that each time you have a particular problem or issue. Similarly, getting to and using bathroom, unsuitable equipment. I can't do things for myself, i.e. I can't get in and out of bed. I've got stuck, left me very distressed. Getting to wash and dress exhausts me. I can't clean my feet, etc. So who? By myself. Day-to-day control, suitability of accommodation. I need more, potentially a wet room or a bath lift, and it will improve my dignity again. So that's how they tend to do when you do your needs assessment. Then that's what you should be able to fill in and think about. The important thing is prepare. I can't tell people more than enough. I'll send you a form out. Look at it. It'll be written not as the law says. I'm telling you what the law says and what your needs are specifically and that they should be met. Can I have the next slide, please? Okay. Once you've had your assessment, they will do a means test. The means test is to say, how much spare money do you have? And can we have some of it, basically, in basic English? They take into consideration your benefits, like ESA, Universal Credit, PIP, just the mobility allowance, okay? And then the mobility component, is left, and the rent. Again, rent is a good one if you've got children living at your property. A lot of people miss out on that. I mean, people if they're living with you and they're growing up to be adults, then you know they have a right to pay their share. The way to do it is to ensure that you can clearly show that you have money from the direct payments account going out to say your account with tagged saying rent and utilities, so that you can say, well, that's his share. If you take that off, that reduces your charges substantially. Okay, and it leaves the money in your account. You still have the money within the household. It's something, again, they won't tell you, and it's a big way of actually reducing. When they do the assessment, it should be comprehensive. The people should know how they are being charged. You have a right to ask, what do you mean minimum income guarantee? What do you mean by this? Can you explain this? Can you explain it? Can you break it down as to what the costs are for? i.e., this is for my care. What does that include? Does it include the payroll? Does it include tax? If it is payroll or tax, the statutory guidance, remember, what says that if you're doing administrative duties for a person, for instance, I employ, like I said, between 7 and 9 people. I physically can't use my hands. My daughter does the payroll, and she is entitled to claim the hours for that. That is in the statutory guidance. So even if you're caring, but you're having to do administrative work, make sure that goes in to the plan so they can budget for it. It is allowable and it is written in to the statutory guidance, so they can't say no. It's another way of, it's not supposed to be income generation that made it specific. It's not supposed to be a job, but it's just a way of helping you to manage and do a bit of work. You have to support carers when they're looking at it, financial side. They have to look at health and well-being and their own health for carers and how effective and safe it is. Person focused, this is thrown around a lot, but it means you should be in charge. You should be telling them. But it very rarely is. They tend to take charge or want to take charge and control the process. It doesn't make any sense why they do that. The charging rules have to be done equally. One of the great biggest issues at the moment is there's been 3 judicial reviews. Started off with Norfolk, then there's Birmingham, and there's one in Scotland. All 3 have said that charging everybody at the same level is unfair and discriminatory under the Equality Act. Okay? Discrimination isn't allowed by law. It says you can't treat people less favorably than others. So what they're saying is, if you can earn some money, you're allowed to keep it under the Care Act. So if you have a job up to a point, whatever money you make from that job is not counted in your costings. So these 3 cases basically argued, well, I can't work, so I can't bring in any more money. I don't have that choice. So you're treating us all the same, regardless of some people whose income will be better because they can work and some people who can't. It is a big issue, and I don't believe any authority is really, even though we've had 3 judicial reviews on this case, following the rules now, because that's what should happen. There should be a system of assessing where capability of work, earning money to enable you to pay some, I'll leave you with more money. Or if you can't, then that you bring those people up to that level so that they're not treated any differently. The one proviso that's in the legislation, which always gives a headache and they'll throw at you, is it should be sustainable for local authorities in the long term. It's understandable they don't have a lot of money and they will throw that at you. But there are arguments you can put to them. For instance, if you allow us to do our, I'm sorry, I'm trying as best I can, but I have throat issues because of my voice. Maybe like if afterwards you can listen to it on YouTube and make it a bit more clearer. I do apologize. It's a health problem that I can't do. I've got specialist equipment, microphones that should be picking up my voice. It's the only way I can really communicate using my voice. So I do apologize. Okay, for the sustainability, it's good to, you could argue, well, you don't have to do things the way you do. You can save money. You can stop paying care companies and allowing us to run direct payments, which will save you 50% of the cost of care. You can stop sending social workers around to do 3 hours worth of assessments and then send me forms that have nothing, what I've said, not written into them. So it's basically, there are things that they could do to make it sustainable, but they just choose not to. We can also argue saying, hey, there are 2, hopefully 3 authorities who don't charge at all. Charging is a choice. They don't have to charge. So by charging, they are just making it difficult for people, for everyone at that time. Can we have the next slide? There are always ways around it.
Iggy, do you want to take a break?
I will do, take 5 minutes.
Okay, that's great. So we'll take a break. It's now 12, just after 12:50. Should we say just before 12 o'clock?
Thank you.
Great. Okay. See everybody very soon.
Yeah, if you want to grab a cup of tea, help yourselves. Or if you've got other questions you want to put in the chat, do keep putting them in and we'll keep an eye on them.
Yeah. I mean, I know that that's what my job. Is that right?
Say that again, Corinda.
I said that's supposed to be my job, right? Helping you.
Ah, well, you can help me this afternoon. Is that all right in the next meeting?
All right.
We've got loads of people on helping today. Thank you.
Could I ask a question at the end because I can't write?
Yes, of course, there'll be some time.
Thank you.
Yeah. Thank you.
We try to work with all organizations. The thing to bear in mind is we're not funded. We are just peer workers with years of experience and practicalities. I've dealt with barristers and legal people all my life through my career, and I've gone against them and been against them. I'm not saying I'm better, but sometimes they don't understand the emotional content that affects us. It's very black and white to them. This is what the law says, therefore this happens. But if it doesn't say it, it doesn't happen. What we're trying to do is find a way around, to work around and causing enough of a voice to make authorities think differently. That's the purpose that we're trying to do. The legislation is there. I can teach you in 5 minutes how to look it up and find a specific point, because it's all there. But it doesn't matter what legislation you have. It's how do you get the authorities to do it. We know Norfolk has plenty of points in Norfolk. I just produced and posted 5 judicial review cases that have recently come out that make an effect on all the decisions social care make that they've not included. That's not our problem. If they're not applying the law, that makes it, doesn't matter if you know them. It's how much energy you have as a person to be able to fight it. And not everybody's got the energy. They just don't. I'm the first one to say, get educated, learn about it. And like I said, there's lots of organizations. What we're doing is trying to share. I'm not saying I'm the expert. What I want to do is, like today, I'm learning just as much from you guys, because there'll be stuff that I don't know. I'm just sharing what best knowledge that I have. My knowledge does come from the law. I've studied it in-depthly, section by section, not just the law, regulations, statutory guidance. And I must spend 5 or 6 hours a day just reading stuff, just to keep updated. But yeah, I love Cascada. They do a brilliant job. Okay, can we move slides, please? Just one thing on the finance side of things. Remember, when they give you a budget, the budget is not for your hourly rate of care or PA. The budget must be to meet your need. Okay? So they'll say, yeah, we'll give you 6 hours at 12, 13, 14 pounds an hour. They have to pay minimum wage at least. It's like, well, hold on. What's that for? Well, to get these things done. Oh, but what about this? Is that need being met? They can't say, we'll just give you this much money. They have to meet your needs. That's the main point of the Care Act. And within those definitions, if you don't get all your needs met, because the law says if they're human, they might make mistakes. In my view, they make too many mistakes. The law has a get out clause in relation to charging. So if they have assessed you and not taken certain things into consideration, these are known as disability related expenditure, i.e. additional costs that you may have because of your disability. Now, these are listed in Annex C of the statutory guidance. There is a definitive list. Don't let them say, well, yes, no. Check the list. We've produced a guide. There's plenty of other guides. Inclusion London do one. It's really good. You can just fill it in and it'll give you an answer. But we've done a comprehensive one that's updated, which over a period of time, we've got everything from what is a DRE, what are the issues with DRE, case law, not just judicial reviews, but other case law relevant, case law from the Ombudsman and the Health Ombudsman. So there's many previous cases that you can use to say, well, if this decision has been made previously by law in a court case, a person is allowed to use that because it's called setting a precedent. Precedent, i.e. somebody's made that decision before in a court. So why waste time fighting about it? Again, we just use the same decision as long as it's relatable to that matter. A lot of cases that might be won or lost. and you think, oh, well, that's a good case or that's a bad case. To me, that's not the point. It's what the judge says in that case. Like Birmingham, very similar to Norfolk, on charging, this person couldn't work. He's being charged at the same rate as other disabled people who can work. The judge says, yes, Norfolk applies. The only reason why they didn't win is Birmingham argued, and they have specific reasons for arguing this. You can't use it as a general excuse like everybody does, i.e. we're in trouble. We don't have the financial resources. In the Birmingham case, the argument was, we're being sued for a case we lost in relation to equal pay. The costs of that are going to be so huge that Birmingham is virtually going to be bankrupt. It's very specific in that relation. So other people might say, oh, well, Birmingham lost. That's not the point. Judge still said Norfolk applies. And they could have changed the process because that's what it was about. Well, under the circumstances, the judge couldn't make any other decision to change it. So it is the specific bits within not just the law, but the case law that applies with it. You read the case law, I mean, I'm sure Giselle's will put, we try and produce easy read versions or simplified versions of the case law, pulling out the individual things that the judge has said that people can use in their arguments. So if you've got additional expenditure or for your disability, then you're entitled to claim disability-related expenditure. This is taken off your care charge. What it says is any additional costs relating to your disability. That's what it starts with. The list is not conclusive. It doesn't say this is the end of the list. That's it, you can't have any more. It does say, and any other additional costs. So as long as you can argue that it's a disability related expenditure, you should be entitled to claim it. So what does it say? It says things like specialist soap powder for washing clothes, if you have skin allergies, etc. Disability equipment, including IT, especially for people who have vision impairments. It doesn't just say about buying it, but it also says about repairing it. Okay, so if you've bought a chair and you need it serviced, you need it repaired, you can claim that as a disability related expenditure. When it comes to, it's not just disability related. They have said if it's age or medical, you can add those things in. It's a big argument on the medical side because a lot of local authorities will argue if it's medical, it's not us, it's health. But under DRE, you can claim it. Any care not supported by LA. So if you need care and they haven't supplied it, and you pay yourself to get that additional care, you could claim that as a DRE. Disability-related clothing, trousers, specialist trousers without seams, easy to wear, hooks, easy to take off clothes, velcroed, button fastened, whichever. These things will always cost a little bit more. And therefore, you can claim those costs back. They're not the same as just going to Primark and buying a pair of trousers. Or if you have clothes that you pay to get adjusted because you need it for a particular reason, then claim those adjustment costs. I've said about the blindness. When it comes to fuel and transport costs, what it says is if you have got motability payments, and the motability payment is used up in buying the vehicle. So say you got your £300, you need a specialist vehicle. All your money from your mobility is used up. Any additional cost, i.e. like fuel, you can claim as a disability related expenditure. Okay, so whether it don't have to be your car, but if you get mobility and it's used up, then you can claim for the additional costs. Community alarms, mobile alarm system that they provide for emergencies, you can claim for that. I've argued that instead of a community alarm, I need a mobile phone, because that acts as my community alarm and communication aid and various other things, because I can just about use my fingers, can't do anything else. With the NHS reducing specialist food from the GPs, if you have needs, that mean you have additional dietary needs that require you to have more expensive foods, then you can claim for those. There is a case very recently from Bolton where the young lad claimed for specific branded food because of his autism, that because of the picture, the box, etc., that's what he preferred, and he was allowed to claim that. Well, there are, like I said, Giselle will put out, there's 5 recent judicial reviews, and they all make judgments and clarity on the law, because the law doesn't stop evolving, it changes. You know, with every court case that happens, because people don't know, but that's a different course for later of how the law works. Also talks about above average heating costs. So everybody is going to pay heating costs, but because of your disability, say like myself, I can't move my body, I don't generate heat, I have to have the heating on throughout the year at a certain temperature, and the NHS recommended temperature for people with vulnerabilities is 18 degrees C, that the house should be maintained at. Then those additional costs can be claimed. Some difficulty with that, but we'll go into that. Where they've said, I know somebody mentioned about gardening and cleaning, even though it's maintained as a habitable home, is in there, if they've missed it out, it's specifically mentioned that you can reclaim it as a disability related expenditure. That's in Annex C of the guidance. Private or respite care, that's claimable. Bedding, incontinence, so your bedding sheets, don't forget when it comes to bedding, you've got maybe have to wash the bedding more, or there may be other reasons, regardless, like incontinence, etc. But you do have costs above and beyond, which put your electricity prices up. You can claim for those. Lastly, on the list is PA costs. And this is one a lot of authorities have for a long time have been arguing, we don't pay PA costs. But you can claim it back as a disability related expenditure. Not only that, but the Bolton case I mentioned, also in that the judge said PA costs including meals, travel, parking, and a number of other things, are considered to be needs. So they can't turn around and say, you're not entitled. So it's one or the other. So even if they miss out on the needs, you can claim it back up to the point where you're zero. Again, this is another thing. Nowhere does it say that it should be up to zero. Because we have additional costs. And they'll say you got PIP for that. But does PIP cover it? Again, use the evidence. Scope have done a fantastic report that says disabilities can cost up to £1,500, for people with severe a month. How are they supposed to survive? So using all the arguments that are there, you can bring your costs down. Remember, it's any additional cost relating to disability, age, or medical. Okay? It doesn't just say, these are just examples given, but it says any costs. So you may have to argue it by way of proving that it's a need, or etc., by the cost, and actually making a complaint. And that's the bit which is, okay, so you know the law. What are you going to do with it? How are you going to get them to listen? Next slide, please. Talking about complaints and debt charges as well. A lot of people are facing charge debts. We've done a letter in our DRE pack that you can send to your local authority saying, I don't agree with your charges because you've missed out all these DREs over the last X number of years. You've not allowed me to claim. I've now found out I can't claim them, so I'm not paying this debt. Now, what happens if you don't pay the debt? They don't come in and just take away everything. The law doesn't allow them to do that. Okay? You do have a right to complain and challenge it and say, I don't agree because you've not counted all my expenses, which if you had, would have lowered the cost to next to nothing. So you do a letter of complaint. There is a specific procedure when it comes to complaint. And when it comes to complaints, this is the important bit. Don't just say, I'm not happy. Don't say, this is just silly and doesn't make any sense. I'm not happy. I want to make a complaint. Say, I want to make a complaint under the statutory social care complaints procedure. There is a specific complaints procedure for social care. If you look online to your local authority and you look at social care, you put in complaints, you will find a list, a complaint form, which is specific. That complaint form has time limits, has things that they have to do, and it doesn't stop at level 1. You can okay, it's a local resolution, it's part of complaint 1. You complain to your social worker, you're not happy. If it's still not dealt with, then you have a right to go to level 2 of the complaint. So senior manager, etc. This is the process. If you're still not happy, then is the decision whether you can go to ombudsman or take it to court. Taking it to court is costly. It's very time consuming, and they don't like people taking their own cases. And I've taken many because they think most people don't know how it works. I think, speaking to a lot of people, there's a lot of people out there who are more knowledgeable than social care practitioners and social workers, because you've had to learn to do that. Okay, So say you end up and you do go to court, what's going to happen? It's only until the court says, yes, you have a debt that needs to be paid, that they can then think about recovering that money. Before then, it's just a debt. And if you're in disagreement, it's not even a debt. We're still in disagreement. That doesn't stop you then going to if they still decide to take you to court and saying, Your Honour, as you can see, this is a list of my DREs. They've missed them over the last 4 years. I'm entitled to these by law. So therefore, I want you to say, set the debt aside or recalculate it, taking those things into consideration, using what you know from the DRE list, using case law, which adds to other things in relation to law. It makes it a little bit clearer. So that's the complaint process, and that's what happens in relation to a debt. A lot of people think, oh, I've got a debt, I can't pay it, or they're going to take me out. It doesn't work that way. The system is very clear. You have a right to challenge the debt for whatever reason and say, no, because you're not doing your job properly. You haven't taken all my needs or all my DREs into consideration. Okay? People think the law and judges and barristers and they're just people. They're people who've read certain books. If you spend the time reading the same books, you'll know the same as them. You know, just because I personally, in my life, don't rate qualifications. I rate people, how good you are. I've seen some incredible, expensive barristers who've done such a bad job that you think, oh, so even if you do get a barrister involved or somebody involved, it's not guaranteed, like Scotland, like Birmingham. Because if I'd been at Birmingham or Scotland, I would have put up alternative arguments. Like Birmingham haven't proven how much the costs are. Birmingham are just saying that. Please produce them. And now, if you look at the news reports, there's plenty of news reports coming. Have they overestimated their costs? In which case, if they have, Birmingham case would be different. So there is more to think about wider. Okay, next slide. Talked about the complaints process. It is slightly different if it's health, because there is an independent review process as part of health before you go to the ombudsman. Like I said, the complaints, they should respond within 20 working days. The problem is they don't. Like me, dealing with my own issues, I get a response on a Friday afternoon to mess my weekend up. And then when you do respond back to them, you get an automatic answer back saying, I've gone on holiday for 2 weeks. So it's just like, are you doing this on purpose or what? You know, they don't respond until the last time. When you go to the ombudsman can be hit and miss. What a lot of people, and it's wrong because their own processes say they should be looking at these things. But generally, my experience of the ombudsman has been, is there a process? Whether that process is legal or not, whether that process is right or not, doesn't matter. They've got a process, they're following that process, then more than likely, in my experience, and also depends on who gets your case, how knowledgeable they are on social care matters. to be able to argue your case. But I have some responses I've had from the Ombudsman, just thinking this is just complete nonsense. You know, I've clearly shown where the law has been broken. And like, well, they've got a process and they follow the process. What about the law? And that's the problem. It's when we don't have people following the law. And the law is decided not by an individual office or a person or a social care worker. It's decided by the country via the voting system, the democratic voting system that we have. So the law sits above processes. Next slide, please. Right. Just give me a minute and then we'll go for it.
Do you want to take a break, Iggy?
5
Shall we-
minutes.
5 minutes.
Yeah.
If we have 5 minutes, that gives you all an opportunity to put any extra questions in the chat, ready for Iggy coming back.
Questions, where should we start? Oh, nobody.
I've got a question, please.
Yeah, go for it.
I have had a major fall and left with use of no right arm really at all. What the local authority or social worker manager said, because he didn't identify this need, I'm not entitled for any help to communicate with, like, the Ombudsman, the financial assessment department at the council. The financial assessor came out from the council who asked me to do things which was beyond my ability. I asked him for help, which he said there was no help. I asked him to contact my social worker to provide this help, to give the DREs to their department at the local authority. The social worker put in writing he was not going to give me any help at all. I kept raising the complaint for 2 years. I have now gone to the Ombudsman and it is becoming an absolute nightmare. The LA have told the Ombudsman there is help available, and yet I have in emails the proof that they are denying me help. I have run out of money. I have a care plan, which has been at the Ombudsman, and they were found, the local authority was found guilty of neglect.
Hold on.
June 2022, I've had no care that's on my care plan. Nobody's changed my bed. Nobody's done my housework. Nobody's took me shopping. No community, going out in the community at all. And when I asked for help, it's like it wasn't identified. So they were told I've had no care since June 22. In August 23, the Ombudsman told them to get care in my home. There is still no care in my home. I'm still using all my MIG, trying to buy people to come in to change my bed or do housework or washing. I went back to the Ombudsman and said, what is your policy for following up on previous decisions? There appears to be not much of a policy. And I sit here today since June 2022 with none of my care plan in place. The council moved me in June 2022. And if you look around on my picture, my whole lounge is still full of packing boxes. I live with another disabled person, and this is all we can use of the lounge is one seat. there is boxes everywhere. But it's a financial assessment that I feel is so important for me. I do think I understand it, but because I can't communicate in writing, what I say to the ombudsman is not being taken seriously.
Yeah, obviously that's a horrific situation for you. In order for me best to help you is if you contact me
Okay.
afterwards, email's best if you can use that. If you can't, let me know, then I will try and assist you and ask the right questions, at least,
Thank you.
to challenging them with you. They should be providing advocacy as well. But there are other ways of putting pressure on local authority and social care and the actual decision makers. And the decision makers are the councillors, not social care. They have all the power. Sometimes when you can't get so far, you have to go beyond and get to the top. Now, not many emails get to the top because there's always a secretary who will filter out and not respond. Probably quite rightly, because my right at the top is really busy. But again, there are ways around it.
I just feel I'm struggling, to be honest.
One of the things I do is every month I read the minutes from the social care meetings. They publish them online and they make decisions on a lot of things that are happening years in advance. In those meetings is a list of councillors, including who's in charge. I don't like doing this, but I feel sometimes in the worst situations, send an email to that list of councillors and the person in charge. Councillors hate getting email, and they will ask the person in charge of that matter to respond. I mean, recently I've taken mine to the board at the ICB, but the only way I've managed to do that is by including him into an email I sent to all the health and well-being board members, regardless of whether they're involved. What that made is him having to say, I will look into it, because other people are involved. They're going, why is this happening? Because it's the councillors who we put in charge, put the pressure on them to do their jobs. So there are bits and pieces always you can do, trying to work around the system when you're not getting the appropriate level of help and assistance.
But I don't understand the care for my arm. He gave me, I think it's 28 to 30 hours a week of care, but didn't identify a need of help that I would need to communicate.
Yeah, well, let's look at that. We'll come back to you.
Okay.
Just send me an email. Okay.
Thank you.
Anybody want to read through some of the ones in the chat?
I
Can
think
I just say something? Yeah.
Yeah, of course.
I don't know whether you'll be able to answer this or Katie will be able to answer this properly. My carers use the Birdie app as a way to write notes down after every meeting. But I find it really intrusive and it's not very nice because I'm a victim of domestic abuse, and also because of my autism, I'm quite sensitive what they write. They only write like, instead of writing the full information, like I'll say to them, oh, I had to empty the fridge because I never emptied the fridge because I never ate any of the food. They'll just put in a note, oh, there was a lot of washing up to do today. Is there a way that there could be a way to reply?
One is you can make your own notes, because they are your notes, not theirs. Do you have a chance to have your say on the app?
No, it won't. It's only one-sided, and it's just so upsetting because, like what you, I'm by myself, and when I say to them, I had to go through the fridge. The other carers who were there before me, I went, oh, are you okay? Have you eaten anything? Are you? But these ones just automatically say, oh, there's a lot of washing up to do, instead of like thinking about why there's lots of washing up to do.
Yeah, you might want to speak to the agency and explain that you want them to either, why, first of all, are they taking notes? What's the reason for it? And if they are, can you please make sure they're taken accurately?
Yeah.
You don't feel that those notes are accurate, because they don't reflect your need. Because at the end of the day, those notes, though there's no requirement for them in social care, is a reflection of your needs. My team, I do ask them to do notes. The reason why I ask them to do notes for everything they have to do, like even if it's give me a sip of water, because it allows me to then go, if they try and say to me, well, how are you spending your money? I can show, there you go. That's what happens to me every day. That's what I've got to go through, you know, hour by hour, minute by minute. And you don't have to do it all the time. Every now and again, particularly if you're coming to a review or a reassessment, and you kind of ask for a reassessment, sort of if your needs, you feel your needs are being met. All right, Tash.
All right, thank you.
No problem.
Hi. Does the LA have to provide an alternative advocacy organisation if the service users had a very bad experience with the commissioned one?
Yeah, the law doesn't help with that. But I would say they should offer an alternative if the advocacy organization isn't adequate. I've worked for an advocacy organization. Issue for me for advocacy organizations, they are paid by the local authority.
That was what I was going to come to next, because the experience I had was that they're not independent and they're actually secretly colluding with the local authority.
Absolutely.
And so they're not there to help you. And it's happened multiple times. I
got told off for doing too much for people. They said, we're not here to do that. Well, that's advocacy, not to them. They just want to follow it up to the point. But again, that's something you should be taking through the complaints process, the statutory complaints process, because they need to know about these issues. One of the things that happen is every 2 or 3 years, they commission these services. So they put out a tender to say, who can do this job for us? If people don't let the authorities know, they go to the authorities and they say, if you've got any issues, oh no, everybody's happy. So if you don't let them know using the official complaint system, it will never become an issue.
The problem is when you go through the official complaints procedure, it's usually just a cover up, whether it's health, whether it's social care.
Doesn't matter, because once you go through the official social care complaints process, one of the things that is always a big issue for counsellors is how many complaints has there been. So if we are talking direct payments and you say, I've got a particular problem, excuse me, I've got a particular problem. They're dealing with 1,000 people on direct payments. One complaint, okay, mistakes happen. But if you haven't told them, and if everybody did tell them, and they got 10, 20 complaints, they start going, but they're not providing the service that they're paid to provide. And I give you an example, wheelchair services in the NHS. In Lincolnshire, we had the same problem. I talked to the commissioner said, there aren't any issues. So I put on various sites, local sites and the people I know. Do you have any wheelchair related issues or complaints that you've made? Please let me know. I had a list of about 20 or 30. I took them to the ICB and said, here you go. It's a big issue. And then they started looking into it. And in the end, they got rid of them. Fortunately, the new ones not much better. But you can use that information. The other thing you can do is there's two pieces of legislation: freedom of information and a service access request. One is in relation to data protection and in relation to your information. You are entitled to anything they hold that is in relation to you.
Can I come back on that? Sorry, can I just come back with the subject access request, for example? I made an NHS one and they refused to give it to me. I took it to the Information Commissioner. They took almost a year. They sent partial. They still haven't sold the full amount.
Yeah.
And I'm very, very ill. And so I've not been able to make an NHS complaint because I still don't have all the records. So I don't know whether I should then go back to the Ombudsman, ICO, Information Commissioner, a third time to say, well, they still haven't given it,
Yeah,
or not.
I would, because they can be fined by the Information
Oh,
Commissioner.
thank you.
Basically saying, look, they're just laughing at you, by not providing the information that you are legally responsible for.
But the problem is, the problem is that I think there's a deliberate delay to put you out of time for making a formal complaint. Because once you go over the 1 year, well, what are you supposed to do? It's been more than a year now.
I completely agree with you. I've been through that situation many, many times. My local authority, NHS, just got me out of time to doing a judicial review just by asking for a couple more weeks. And one final meeting, we can sort this out. Nothing got sorted. But then that left me without the time. The way I look at it is, it'll come around again. It's fine. It is a long game. My disability isn't going away. My needs are going to get worse. And next time round, I'll just be prepared. And I wrote to him and told him that. I said, okay, you played your game. Next time we're going straight to court. I'm not giving you the opportunity.
But I'd say for most people, it's restrictive financially to go to judicial review. They can't afford to go. And for people who can get legal aid, they can't access any firms because most of the companies that used to provide social care, community care law are no longer under, no longer providing taking on cases.
Okay. I have a way around that, but it's not easy. there is a simple court process called a small claims court, which is for any claims below £10,000. Okay, including damages. It's all doable online. And it's basically, you can even have court case online, sitting there with the judge and the other parties. And it is a matter of telling your story in the best way possible and making sure you've got the relevant sections and law to argue those cases. The whole system, small claims court, has been built so that individuals can navigate the court system for small things. I don't think £10,000 is too small. There is a cost, but the cost is minimal. It's less than 10% of what you're claiming. And also, if you've got disabilities, you'll get additional discounts.
Is it enforceable? Because I'd heard that the
Oh,
small
yeah.
claims.
Yeah, it's completely enforceable. It's part of the judge system. There are ways, there are additional steps if they don't do what the judge says to make them do it.
But there's a 6-year time limit, isn't there, taking it to the small claims court?
Yeah, for each legislation has its own time limits. Okay, so under the Equality Act, if you're arguing discrimination or wanting to do a judicial review, and this is one of the biggest problems, you only
6
have
months.
3.5 months.
Oh, it's 3.5. Oh my
Yeah.
God.
From the time you notified of the issue. Judges will extend that time because they know how the game is played. So I've done a few couple. One was against wheelchair services for not making reasonable adjustments, expecting me when it was cold and I was ill to go and visit them in their big, windy, cold office where they don't have the right equipment or the right bed for me to be able to use to actually get it. And they reassessed me 4 times and told me it's the way I'm sitting. So I said, well, that's not your point. You're supposed to assess me, give me the equipment so I'm sitting right. And after 2 years of this, I took them to small claims court to argue that case. Quite a simple matter. Most authorities, believe it or not, as soon as they get their court summons, they realize you're serious. And you do have an opportunity before going to court to actually mediate for free. It's part of the system. There is a mediation system involved, which basically third party is involved, independent. You tell them the story, they tell them the story. Mediator says, what do you want to happen? They'll say, what do they want to happen? If you agree, it's a signed agreement that you can take back to court. If they don't do it, and it is free and part of the process. Really worthwhile doing. In the wheelchair case, they paid out, compensated me for the distress caused. So, any more questions? Like I said, don't worry. If you put questions in the chat and we've not answered, I will be sent them and I'll do a written answer and it will be responded to.
Can I just ask a quick question, please? Is there any case law that's shown that someone that lives with somebody who is currently receiving direct payments is the best and potentially only person who could be employed as somebody's PA? Because we currently have a situation of where I've been trying to recruit for 7 months now. Agencies cannot meet my needs. for various reasons, and my local authority will only allow me to pay minimum wage, and no one will work for minimum wage
Yeah.
that's actually any good.
I'm in the same argument. Like I said, I'm looking at this case for myself. When I get there, there are things I can think of that we can work around, but I'm not there yet. I don't want to make any promises or things till I've
Excuse me. Oh,
explored everything.
excuse me. I was going to raise that I think we need to have a campaign for an independent complaints commission, and so that we can actually see the Care Act 2014 fully implemented, and we need to have an independent complaints commission across the whole of health and social care. Advocacy is so important, and there are independent Social Care Act 2014 advocates. Legal advice and using the law is beyond a lot of people's basic capacity, and that's why peer support and all the work everyone does, Giselle, yourself, and adult social care warriors coming together is so important.
Don't forget yourself, Melanie.
Well, I'm just a PA user that's waded through the mud, but please, people, to educate, inform yourselves. I have successfully taken my local authority to task, and to go through the statutory complaints procedure is so important, but also to pick your battles, because otherwise all your energy, your mental health, your physical health is just stuck in a vicious circle of fighting. So we build an army, we build strength, unity, and we hold our new Labour government to account. And to this argument, there is a social care commission being put together by disabled people's organisations, such as Greater Manchester Coalition of Disabled People, and having a social care commission, and central to that has to be an independent complaints commission.
There is somebody online, and I have shared his name a number of times, Paul, somebody that I've shared it on, Adult Social Care Warriors, who is doing a petition. Now, I'm knowing how many people there are out there and how many I know. You know, it's easy, and I know people have got issues and they've got their own health problems, and it is difficult. But if people don't respond to those things and just sign their name to it, they're not going to get anywhere.
The difficulty is that when people often first become in need of social care, that is their first contact is while they're in crisis, and it's building capacity so that, and we are becoming more visible thanks to social care warriors. There was no such shared collective information sharing until Giselle brought social care warriors to the forefront. And that's what's so important, is our individual stories. And we need to bring back the ILF. We need to see the Care Act fully implemented, and we need to ensure that nobody is left waiting for years without care. Because across the board, whether you're CHC funded, whether you're local authority council funded, they are cutting back. They are monitoring the time you take.
Can you just...
So I'm going to leave it there.
Thank you. And I know you do a lot of excellent work responding to people's health. So from us, Thank you for all of you do.
Thank you.
With regard to just that, I just want to finish off. We as a group are working on some ideas. And one of the ideas we want to do is for people to create their own local groups. So you're not on your own.
Yeah.
And support each other. And then work that through a national level, through
Yeah.
people like Giselle's website.
Yeah.
The more local groups you have, because whatever you're struggling with, there will be other people struggling with that. Just start off with a Facebook page, starting a group in this area. Anybody can join. We won't have meetings, just people can just talk. Any issues as a collective group, we can share those to the authority. Once we get those collective groups of people across the country, that's how we tackle to get our voices. Because like I said, Paul's, and I was horrified amount of people he's asking for a review to the independent complaints process. And the people that have responded are heartbroken for him. It's so important. And I would have thought people would have jumped on that. But we all have lives, we're all busy, and we do have our own issues. But if you want things to get better, my philosophy, personal philosophy, it's not about you, it's about us. If you make it about you, you're a small voice shouting against a big company. If you want to raise that voice, get together with other people. Make your little groups. Doesn't have to be a lot of work. Just like we've got, Giselle's created, I've created one locally in Lincolnshire. I've got 50 members. Sometimes nothing happens on it. But every now and again, something does happen. I feed it back so local people can get the information. And that information can then be shared at a national level through all the work that Giselle does.
Thanks so much. We're going to have to pull it to a close, Iggy. And a huge round of applause and appreciation for Iggy, for Anne for being part of this, for Giselle and Rachel for working with us to organise the session. And it'd be really good to do more. So thank you for filling in the poll as well. And watch out on social media, on all our Facebook groups for more sessions and more direct payment sessions coming up. Thanks, Rachel.
Thank you, everybody. I'll make sure that you get the recording and the links from today. It might take us a little bit longer to get the answers to the questions in the chat to you, but they will make their way to you. So yeah, thank you very much, and hopefully see you all at something else soon.
Thank you. Thank you, everyone.